The three most common procedures that I do for weight loss surgery, number one is the gastric sleeve. That's a laparoscopic procedure where I make the stomach very small, taking out the stretchy part of the stomach so people get full quickly, and also taking out the part of the stomach that makes the appetite hormone ghrelin, so it helps with head hunger. The second procedure I do is the laparoscopic Roux-en-Y gastric bypass, or the gastric bypass for short, and that's where I make the stomach very small and I hook the intestine up to it in a Y-shaped construction. Great operation, been around since around 1965 and has been very well honed and modified so that it's the modern form that we have today. And then the third procedure that I do is something called a laparoscopic duodenal switch. And I do what's called a loop duodenal switch most commonly. That's where I make the stomach really small, just like in that sleeve, and then I divide the duodenum, or the first portion of the small intestine, and I hook the intestine up to that, just past the valve at the bottom of the stomach. So people stay full for a long time, but we're also bypassing the part of the intestine that lets them absorb fat from their diet. So it's a 1-2 punch where it's restricting how much food they can eat, but also restricting how much fat they absorb from what they do eat. All three are very effective procedures, and I tailor each one to the individual to make sure we make the right choice.